Good afternoon to all the mummies and daddies to be. So I'm going to share something about the lactation-friendly TCM confinement care. With Chantel's help, I think you all already bring the baby home, right? For natural birth, usually we'll stay in the hospital for 2 days. And C-sec, usually will be 3 days. So after that, then we'll be home with the baby. Then started our confinement, right? We'll be confined at home for 1 month. So how to have a lactation-friendly confinement care? Based on some of the clinical experience, we will share with mummies some of the TCM knowledge about this. Okay. By the way, my mother language is Chinese. In case you don't understand me well because of my accent, do type in. I'll try to explain later. Okay. So, okay, actually after we start the confinement, a lot of mummy have we'll start to think how to have a speedy postpartum recovery also, right? Actually, the answer is breastfeeding. Breastfeeding helps mommy recover in many ways and faster. You look at the picture on the right side, there's so many different positions of breastfeeding, right? So mommy can just practice with your little ones every day and start with the best position that you are good at, then carry on. But of course, mommy will start exercise. Some mommy will start exercise quite early because they want to shed off the extra fat that has been put on during pregnancy. But this one must be very careful because the wrong exercise or too early or too strenuous exercise actually may impact your wound healing, regardless whether it's a natural birth or C-sec. We do have a wound with stitches. So be careful with the exercise that you choose and the amount of exercise that you do, okay? And wrong exercise may cause this diastasis recti also or uterus prolapse. So all this must be very careful because with the increased pressure in the abdomen, it will push all this and make it even worse. So and don't start too early also. And also, mommy will start to look for postnatal recovery centers or massage. Well, all this helps mommy to soothe your hardworking body also and your muscles to relax your muscle. But be careful, avoid pressure on your breast because we do see mummies come with mastitis. Actually, it's caused by some external pressure. So since breastfeeding can help so much, so actually, how does breastfeeding help? Mainly is that hormone called oxytocin. Some Chantel also mentioned about this hormone during delivery. Yes, this hormone actually continues to help the body with the postpartum recovery also. So actually, based on study, breastfeeding moms actually tend to lose more weight than mothers who do not breastfeed. So, 加油, I'm breastfeed. Also, this oxytocin, in Chinese, it's called 催产素. It's the same hormone. It's a love hormone and it's an anti-stress hormone. So actually, it helps mommy to feel more relaxed and to lower your stress and the anxiety level. With the new bond of joy, a lot of stress comes at the same time. So a lot of mommy actually quite overwhelmed. And this hormone actually is the hormone to bring the letdown reflex during breastfeeding. Letdown reflex for mummies who have already breastfed, maybe they will know this letdown reflex better. For new mummies, some of you may not be sure what this is about. In Chinese, it's called 奶症. It means when the mummy hear the baby crying or about feeding time, or sometimes when you even think about your baby, then the milk start to drip. Or some mommy even to have a very good spray of the milk. So, and this letdown reflex is critical for a successful breastfeeding. Without this letdown reflex, the extraction of the milk from the breast actually will be very poor. So sometimes when baby latches on or latches very long time, but actually the baby may not get enough milk from the mommy. And also, if not enough milk get extracted from the breast, and the supply will tend to drop because actually our body is very smart. Because this milk has not been extracted, So our body think that, oh, actually you don't need that much. So the supply start to drop. Actually, all kind of problem related to breastfeeding start to come from there. So actually this hormone, or besides this breastfeeding, this hormone also helps with our uterus contraction. That's why during breastfeeding, especially when there's a letdown reflex, mommy start to feel the lower abdomen pain because of the contraction. This contraction actually can cause the blood vessel contract also. So will help the expel of the lochia to expel the lochia better, bleeding more smoothly also, to clear whatever blood left over in the uterus after delivery. And because of this contraction, so the lochia will stop faster also. And of course, they will have less bleeding. Less bleeding, then your body have more energy, then you have a fast recovery. That's how it works and how it links everything. But whether this hormone will just like function well for everyone and helping every mother for this, is it as long as I do breastfeeding, it will help? Actually, there are other elements that will affect this oxytocin secretion. Most of the time, or most of the family members, usually we are like, pay more attention on the babies. You know, there's a newborn, new family member come to the house, but we all forget there's a new mom is born also at the same time. So actually for this new mom, need a lot of love from your hubby and a lot of support from your families. Okay. And this mommy also need a lot of encouraging words, especially regarding breastfeeding. And this mommy need to have all this so that she can have the energy and the mind to nurture and to feed your little ones and to breastfeed your little one. So, okay, since breastfeeding can do so much for us, so then how to have a successful breastfeeding? Is it just a instinctive behavior? Like once the baby is out, when the mommy sees the baby, oh, I know how to breastfeed, just so easily bring the baby to the breast and start to latch. Yeah, it will be fantastic if it works that way, but many times actually it's not. The hormones do make mothering instinct, but in order to have a successful breastfeeding, it does take skills and also a healthy mommy. The picture on the right actually is a TCM meridians. It's a picture, we can see how many meridians actually passes our breast. There are 9 main meridians pass through our breast. The center one is called 任脉. This meridian actually is very important for female. Along this meridian, there's one acupoint. You see, I draw a love shape there. It's called 膻中穴. Usually I tell mommies, oh, it's a happy point. But then mommy say, oh, but when you press, I don't feel happy, it's pain. I say, because you're not happy, that's why it's pain. You're stressful. So actually for mommies, when you experience like, oh, I can't breathe, I'm so congested, I'm not happy at all. Actually, it affects the milk flow. It means it affects the letdown reflex. Maybe you have lots of milk in the breast, but you just feel the whole breast is so engorged, so full, but the milk doesn't spray, doesn't come out. Then baby will latch, then cry, latch, then make noise until give up again. So in case you encounter that, try to take a deep breath and press these acupoints, just like, roll, massage and press, massage and press. Whenever you can, just do it. Actually, it's just the point that where we do CPR, the compression point. Okay, it's quite easy to locate. Same level as the nipple. Of course, when we lie down, some bigger breasts, maybe it's not exactly the same level as a breast. So you can feel it, actually there's a depression right on top of the sternum. And another meridian you see is the kidney. This is a Shang kidney. And we have this pericardial meridian and also cardiac, the heart. It means in TCM, actually heart got 2 meridians. One is the pericardial, one is the cardiac meridian. Cardiac meridian is not in this picture because it's ended below in the armpit. It's inside, so we cannot see from this picture. So you see, we have this heart and we have lungs. You see, the lungs also affect our breastfeeding and spleen. This is the gallbladder, and this is the liver meridian. Okay, gallbladder and the liver meridian actually are two most common meridians that will affect the breastfeeding, the milk supply clinically. So if mummies have ever come to see me, they always hear me. I keep reinforcing about this liver, gallbladder thing, and what time you need to sleep, and what time you need to wake up, and all this, okay? Because it does affect our breastfeeding very obviously. Okay, you can see 9 meridian out, the rest actually that will already be like, it doesn't related to the breastfeeding. Actually, it's not. The rest of the meridian indirectly linked to whatever we are showing here. So actually, almost every part of your body affects your breastfeeding. So that's why why in the confinement there's so many do's and don'ts, because any abnormalities of the body affects this, especially in the olden days. There's no formula, and it depends on the mommy's milk to nurture these little ones. So anything happen, if no milk, there will be a lot of trouble. That's why confinement become a very critical thing, and it also become a miracle thing. So you look at this picture, I think maybe you have already heard about this from your friends or your family members, the mother-in-law, parent, or mothers or aunties about all this. You see, cannot take a shower, you cannot step down off your bed, cannot touch water, cannot wash your hair, all this. But is that true? Especially in Singapore, it's so hot every day. Is it possible to just, I don't do all this for one whole month? It's impossible, okay? And of course, why then all this information has been spreading from generation to generations? I think it's because of love, because our seniors want us to be well, to recover faster, and to have a good supply, and to take good care of the child. That's why all because of love. Okay, but love sometimes does hurt also, right? Actually, it's the fear of knowledge deficit. Actually, it's because of knowledge deficit. Sometimes when we ask the mummies, okay, why I cannot do this? Actually, our mummies also don't know how to explain. They will say, oh, my mom tell me that, so yeah, so I tell you that you better don't do. Okay, so exactly what is the reason? It's because confinement sickness, so-called, we call it 月子病. It means any sickness that happen postpartum, after delivery, during the confinement. I translate it to confinement sickness. Actually, in Chinese, it's called 月子病. In TCM Gynae, this is a big chapter talking about all this. Actually, in TCM books, there are more than 40 types of confinement sickness. Of course, I will not be able to explain everything one by one today. I have picked a few common ones to share with mummies by week. Because for this confinement, for the first month, there are 4 weeks, right? You will be confined at home. So I will introduce to you by week, what are the common issues that you may encounter. During the first week, usually it's a breast engorgement. Okay, if some mummy baby start to latch very well after baby is out, this may not be very obvious, but for mummies, if the delivery process is quite long, I use a lot of IV drugs, IV fluid, and if baby doesn't latch well, this will come. And usually it happens from the 3rd to 5th day if the body is not so weak. Okay, how to avoid this? Usually, some mummy already aware of this. They will come to the clinic to do a prenatal lactation acupressure. It means to prepare the breast. Usually, it's 2 weeks before the EDD. Then we'll start to do some massage of the breast to prepare the breast. Okay, but this may induce early labor. That's why we usually do it quite gently. And after back home from the hospital, when this happens, because usually it happens from the 3rd to the 5th day, when it becomes super hard, the breast and the pain, but nothing come out, usually our LC will advise mummies to use cabbage leaf. So actually, yeah, cabbage is not a confinement vegetable to introduce, but it's important to stand by one cabbage in the fridge in case you have a very bad engorgement, then can use that. So you should put it in the fridge, you peel off one piece of the leaf. I would suggest mummies to use a roller to roll it so it will be softer, then put it on the breast. But when you use cabbage leaf, you need to be very careful because this cabbage leaf actually can reduce supply. And don't use too often, like twice a day each time, or make it about 20 minutes. Actually, nowadays we have another alternative, which is the goat yolk. This is a plaster, TCM herbal plaster. We have a TCM herbs inside. It's a traditionally we call it goat yolk locally, okay? This is a breast goat yolk. For this plaster, it helps to relieve the pain, reduce the engorgement, and prevent mastitis without reducing the supply. But of course, there will be some herbal smell. Sometimes baby may not like it. And there's another thing is the red date tea. I realize our local mommy, red date tea is so-called it's a very common drink. It's a must-to-drink drinks for all mummies during confinement. Actually, for mummies with a very bad engorgement, really, I do not suggest to continue with the red date tea. There are different recipes of this red date tea. Some mummies recipe, our nanny usually will prepare this, actually different recipes. Some recipe actually quite heaty. If mummy already have a very bad engorgement, then if continue drink this red date tea, it make it worse. And it make this engorgement turn into mastitis faster. So for the clinic, actually I have formulated a tea called milk down tea. This tea, it helps with the milk flow, and yet it's not heaty. So actually, mommy can start to drink this tea and bring this tea along to the hospital. Once baby is out, actually can start to prepare this tea and start to drink. So we will help with the better flow and with the milk to come down earlier also. And for during the confinement, week 1, week 2, we suggest to take this milk down tea because it's a better control. It's already registered with HSA. It's a much safer tea for mummies. And for milk booster tea, this one is actually not all mummies will have this breast engorgement. Some mummy, especially if have very heavy bleeding during the delivery process or the body generally is weak, may experience a super soft breast. It means until the 50s, still the breast is very soft, no milk comes, it seems. So I have a milk booster tea. This milk booster tea, inside there's one herb. Actually, based on study, it increases our prolactin level. It increases our prolactin level, so it will bring the milk come faster also. But for generally, if mommy is engorgement, I would not suggest to take this milk booster tea. Usually we can start this in the week 3 and week 4. That's when the baby's demand increases and we need to have more milk. So can start with this milk booster tea. And for mommy with a very soft breast until the day 7, day 6 still don't have a good flow, then we can start this early. And of course, early direct latching on demand, that's very important. So usually our LC in the hospital will do this job. And for the second week, that will be the mastitis, okay? Or either mastitis or low breast milk supply. But usually the low breast milk supply in this week is usually not the real insufficient, real enough. Most of the time it's because of blocked ducts or mastitis. For the first picture, you can see there's slightly redness of the breast. If at this stage, if you see a TCM doctor, if you come to the clinic, usually we will use the mastitis tea also. And usually 1 to 2 bottles then can solve the problem. The milk start to come out and this redness start to disappear. This is the early mastitis, we call it. In TCM, it's called 乳痈. So this is very early, like 初期 starting only. If at this stage, mommy not aware of it, then if wait maybe another 3 days or 2-3 days, it may become even more reddish and more painful, and the lump become harder. If at this stage, if you come to the clinic, usually most likely we'll take about 3 to 5 bottles or 3 to 5 days of this tea, this formula. It helps to solve the issue. It's still not too late. But some first-time mummies actually really not aware about this issue, and especially when mommy Google or join some groups to share, ask for this issue. Some mommy will say, oh, breastfeeding, sometimes it'll be a bit painful. It's normal, but everyone is different. Actually, some mommy find really is abnormal. It's already a mastitis. And from mastitis stage 2 to this stage, abscess, I'm not sure whether you can see clearly, and this area is an abscess. Okay, it means it's already become pus. The milk in the breast already become pus. If it become like that, you come to the clinic, I will try to clear, see whether it can clear out from the nipple. If the pus doesn't come out from the nipple, then we'll need to refer to a breast doctor. So our breast surgeon usually will do an ultrasound guided. We will do an ultrasound first to confirm whether there's pus inside. But by this stage, usually there is pus. So they will do a needle aspiration. It means do some LA, then put in a needle to take out the pus. We have to do this. And for some bad cases, or may even to do a surgery, it means need to make an opening to drain the pus out. If we don't do that, the wound cannot heal, and it could be very harmful to our body. And if by this stage, it will take longer to recover also. So in case mommy got this mastitis with abscess, of course, the postpartum recovery will prolong and become more complicated. So before I move down to other problems, other confinement sickness, maybe let's have a look at some statistics of the breastfeeding condition in Singapore. Actually, you see, on the day of discharge from the hospital, we don't see exclusive breastfeeding, like any breastfeeding, like mommy want to pump and feed, also we counted as breastfeeding. Actually, almost 100% of mommies trying to. But what happened after 1 month? It dropped to 90%. What happened to the 10% of mommies? A lot of them is because of what I have shown just now. Because it happens, then some mommies stop the breastfeeding. And this is by education qualification. We can see that more highly educated mommies actually try to breastfeed. More highly educated mommies will try to breastfeed the little one. And this, so what is the reason of stop breastfeeding? That these statistics, this was done in year 2013. The top one is not able to supply enough breast milk, regardless whether you're a working mom or a stay-home mom. You see the percentage is very high, it's more than 50%. Okay. And actually they interviewed the mummies 2 months after delivery. About half, 49%, less than half actually, about half of the mummies actually can do a breastfeeding smoothly, no problem. And also another half will have issues. The common issues will be like breast engorgement, breast infection, which is a mastitis, inverted short nipple, that will affect the latching. Usually our LC will help mommy with all that. And also cracked nipple, also because of the poor latching many times. And another is not able to supply enough breast milk. Okay. So take good care of your breast, especially for the first 2 weeks. And when it comes to the 3rd week, then we start to see other problems like leukemia. There will be a prolonged bleeding. Something like the menstruation kind of bleeding usually lasts for about 10 days. If after 2 weeks still have the kind of flow, we suggest to see a gynae to do a scanning whether got any placenta left behind, or need to consult a TCM physician to see what happened to your body. But if it already become lesser and darker, that is pretty normal. Okay, some mommy it take about 6 weeks to clear totally. And another is the postpartum sweating. Again, for the first 1 to 2 weeks, if the mommy tend to perspire a lot, that's pretty normal. But if until the week 3, week 4, if still perspired so much, then it could be something, maybe qi xu, means the body maybe is too weak, or other issue. Later we'll show you some pictures of the dam and to teach you how to gauge whether you need to see a TCM doctor or not. And this one is cannot withstand the coldness or wind, like in the aircon room in the same environment. Everybody else feel the same, but you feel like, oh, I need to put on some jacket, or I feel like chills. You know, when the fan blow to you, you feel like, oh, why so cold, uncomfortable, the kind of feeling. This is also a confinement sickness. And another thing is postpartum hives. This is very common, and it usually comes and goes, and some mommy even lasts for months. This one for our Western medicine, I mean for our modern medicine, actually don't have a very good treatment besides this antihistamine treatment. But for TCM, we have three different types of 症型. It means three different types of root cause will cause this. Then we can prescribe the herbs accordingly. Clinical results quite okay, quite nice. And on the 4th week, then we'll start to have also joint pain, like finger stiffness, and even postpartum depression start to become more and more severe, some mummies. And yeah. For this postpartum joint pain, I mean pain here, pain there, actually, which is a common understanding for our mummies and for our senior, older generations. So many cannot do, actually is try to avoid this pain thing. Actually, besides this body ache, this joint pain, we have all that also, all confinement sickness, okay? Is it after the first month, like after 4 weeks, you are okay, you are totally recovered, you are ready to do everything? Actually, it's not. In TCM, these 4 weeks is just called 弥月, 小满月. It means it's just a small full month. There's to have a better and more complete recovery of your body. Actually, it takes about 100 days. That's why there's a 大满月. The real full month is 100 days. Okay. And even after that, some of you may still have some other problems like incomplete weaning. That is after you stop breastfeeding, incomplete weaning, like urinary incontinence, secondary infertility, and diastasis recti, just now we already mentioned. All these are all confinement sickness. So, mummies, this giving birth, delivery, labor is not an easy job to our body. Really need to take care of the body. Okay, here are some pictures that I have collected, because all these 5 terms from different mummies are very commonly seen terms for abnormal ones. All these are the abnormal ones. Because our local mummy usually will purchase the standard herbal package like day 1 to day 28 to take. For all that standard package, actually it works generally for general body condition. But in case your body already, maybe you check your tongue to the mirror every day. If you discover your tongue already become like that, or with other symptoms, other discomforts, would suggest to see a TCM doctor so that we can prescribe some, 针对性 to your problem. You need to prescribe customize the right herbs to your body condition. Like the first one is heaty and dampness. Usually we call it 湿热. For this condition, if you continue to take the confinement herbs, it can really make it even worse. And this one is like 心肝火旺. You see, this is the heart, this is the liver. It's so red, right? So usually mommy cannot have enough sleep and tend to feel like angry, throw tantrum, want to scold people. Of course, it will affect milk supply also. This one is the digestive system already badly affected. Body is very cold. Can see the teeth mark. Can see the coating of the tongue is become so thick and whitish. This is usually seen for our Western mummies. I mean our European mummies, because they don't do confinement. Some mummy even drink cold water or eat a lot of cold stuff or drink veggie juice, fruit juice, all cold. So it may damage the digestive system. Okay. And for this one, it's called 阴虚. It means also something to do with our digestive system. We need to customize herbs in order to help. And this one, you can see a lot of black spots there. All this is an indication of poor blood circulation, or maybe it's just a look here, didn't really clear well. And I know traditionally we take 生化汤 for the first few days, but this 生化汤for mummies with a good flow of this look here, actually really not suggested. Actually, a lot of gynae doctors does tell the mummy that, oh, don't go and take your 生化汤, because sometimes we do encounter mummies come to the clinic say that, oh, my look here still like very heavy flow, a lot of blood clots still like already after 1 week. So need to be careful. 生化汤 is not for everybody too. Okay. Okay, that's all for my today's talk. Hope mummies really can bring back some useful information to guide you through during your confinement.
Okay, thank you, Shana. I think there's one question. So are you able to open up your Q&A to check on that question?
Oh, yeah, I can see. The white tongue on the top left means a lot of 湿气. The top left, just I see it. This one, right? The top left, this one is 湿气, yes, definitely. And this 湿气 has become more heaty. In TCM, this 湿气 we have 寒湿, also have this 湿热. It means got cold 湿气, also got hot 湿气. So for this one, definitely there are 湿气, the dampness in the body. Sometimes we translate it into water retention. Definitely yes. And this one also. 湿疹 the second question, 湿疹不适合喝生化汤. Well, 生化汤and 湿疹 not like closely directly related. But if mommy have 湿疹, usually it's got some dampness in the body and more heaty. Usually it's towards the heaty side. So I would say need to be careful with your confinement herbal soups, including the 生化汤. Okay, got more questions coming.
Yeah, suddenly a lot of questions. I think we only have time for one more. The rest,
Okay.
I'm sorry, she will reply you by typing out the answer, okay?
Okay, I will do that. How to increase milk supply? Any food to it? Okay, this is a very common question. Maybe it's something like I'm answering every day in the clinic. How to increase milk supply? Okay, latch on demand. Be happy, rest well, eat well. There's no miracle happen or miracle food that will increase your milk supply. Instead, actually, a lot of local mummies actually not really no milk. It's because of blockage or some stubborn blocks in the breast. Actually, the milk doesn't flow or poor letdown reflex. And for this kind of mommy, if you eat a lot of milk booster, I know that there are so many milk booster in the market, right? Actually, a lot of it is to replenish the body. It means it's at the heaty side, it's like a tonic to boost. The more you pull, actually you make your condition even worse. If the breast generally is very soft, really no milk, soft, feel fatigued and tired, the tongue looks quite okay, most likely, yeah, you are okay to take that kind of milk booster to boost. But if after taking the milk doesn't increase at all, you don't see a difference, really suggest to see a TCM doctor, then we'll prescribe something like more for your body condition. Okay.
Okay, I think that's all the time we have. So, Decision Shana, you can see that the Q&A, there's a button, it says type answer. So you can type the answer out after this, okay? So thank you,
Okay.
Shana, for sharing the insights from us from her TCM practice.